We looked at the differences between review articles. We interpreted the results of a meta-analysis in a forest plot. We visually assessed the variability of the body of studies in a meta-analysis and interpreted the statistical test of heterogeneity in a meta-analysis. We also assessed the risk of bias in the body of evidence provided in a review. Now, let's critically appraise a systematic review and meta-analysis and evaluate its external validity, which is the course learning outcome number 6 on the course syllabus.
Another tool that's available is the grade approach. It is one of several systems to rate the quality of evidence. We don't need to go into details, but especially guidelines, because guidelines for, let's say for pneumonia, for example, guidelines for pneumonia, because they do a systematic review of the evidence for treatment of pneumonia, they use the grade approach to grade the level of evidence, and they usually come in 4 categories. So there's a high level, there's a moderate, low, or very low. So that's another tool that you can use, and typically systematic reviews use some sort of tools such as grade to evaluate the studies that they have included in the review. So they will tell you, okay, here's the table of all the studies that we have in our systematic review, and then they use the grade system to say they go through different studies, and they say, okay, this study had a high level of confidence, then the next one maybe had moderate, and so that's a really good way of evaluating the evidence that they're putting in their review. Another system is the Cochrane collaboration risk of bias assessment methods. So there are different tools. Depending on the study you're reading, you may come across one of these. Now, how to appraise a systematic review and meta-analysis. So there are 2 things to consider. One is the credibility and the other is the confidence. So credibility refers to the extent to which the review's design and conduct are likely to have protected against misleading results. Credibility may be undermined by inappropriate eligibility criteria, inadequate literature search, or failure to optimally summarize results. Now, for the confidence, a review with credible methods may leave clinicians with low confidence in effect estimate. Common reasons for lower confidence include high risk of bias of the individual studies, inconsistent results, and small sample size of the body of evidence, leading to imprecise estimate. So when we are appraising systematic reviews, we need to consider both credibility and confidence. And here's how we do it. We ask questions. So there are 7 questions to ask to evaluate the credibility, and 6 questions to ask to rate the confidence in the effect estimates. So the first question is, did the review explicitly address a sensible clinical question, right? So that's really important. So if, depending on the review article that you're reading, there needs to be a sensible clinical question. And then the next question to ask is, was the search for the relevant studies exhaustive? So typically, did they tell you what databases that they looked at? That's also important when it comes to publication bias. So if they used a single database, for example, that there's risk for publication bias, because they miss some of the studies. And when they look at different databases, that increases the credibility. The next question is, was the risk of bias of the primary studies assessed? So once we go past the publication bias, then there may be bias in the individual study. So it's a matter of, did they have good methodology on those specific studies that are included in the systematic review? Then the next question is, did the review address possible explanations of between study differences in results? So if there is heterogeneity, then the authors need to come up with some explanation why there is variability. Because if they cannot explain it, then they shouldn't do a meta-analysis, right? The next question is, did the review present results that are ready for clinical application? So the bottom line is, we need to, whatever we're finding in the study, it needs to be significant to the clinical practice. So if it's not ready to be applied in the clinic, then it shouldn't be included. Next question is, were selection and assessments of studies reproducible? So it's important to, if you were to do the same study again, you should pretty much come up with similar results. So it's important to have at least two people participate in decision regarding, conduction of the systematic review. One thing that you can do statistically is the case statistic. So the most popular approach to dealing with chance agreement is the chance corrected agreement, so statistically determined with kappa or weighted kappa. Another tool is the chance independent agreement of phi. You don't need to know these things, but you may come across the systematic reviews and they tell you that like the numbers for kappa and phi, and what they're trying to tell you is whether, because there were multiple people reviewing studies, they want to tell you if there was agreement between um, the people who were conducting the study. So was there a good agreement between reviewers in selection and assessment of studies? So a kappa of greater than or equal to zero point 0.6 is considered adequate. So if they give you the kappa numbers, it needs to be at least 0.6. The same with phi. So if they do give you phi, it needs to be at least greater than or equal to 0.6. So in general, that's considered adequate agreement between the researchers. Then the next question is, did the review address confidence in effect estimates? So ideally, systematic review authors will explicitly address the risk of bias that can diminish confidence in estimates as well as imprecision. So for example, wide confidence intervals and inconsistency. Now let's go to rating the confidence. So the first question to ask is, how serious is the risk of bias in the body of evidence? So for randomized trials, risk of bias increases if there are problems with the randomization, if patients, caregivers, and study personnel are not blinded, for example, or if a large number of patients are lost to follow-up. Stopping trials early because of a large apparent effect also can exaggerate the treatment effects. Now, in observational study, the main concerns associated with increased risk of bias include inappropriate measurement of exposure and outcome, inadequate statistical adjustment for prognostic imbalance, and loss to follow-up. The next question is, are the results consistent across studies? So how similar are the point estimates? To what extent do the confidence interval overlap? And statistical tests for heterogeneity. So we covered these in previous slides. The next is, how precise are the results? So, precision is all about the confidence interval. So the narrower the confidence interval, the more precise it is. The wider the confidence interval, the less precise it is. So if the confidence interval is really wide, then you need to consider, would clinical action differ if the upper or the lower boundaries of the confidence interval represented the truth? So whether it was, really close to no difference or really was a huge difference. That's what needs to be considered. The next question is, do the results directly apply to my patient? So, that's extremely important, because at the end of the day, if it doesn't apply to your patient, then you can't really use the study. Is there concern about reporting bias? So for reporting bias, we talked about the funnel plot and the exercise that you can use to answer that question. And then the last question is, are there reasons to increase the confidence rating? So the judgment about our confidence in the effect estimates applies not to a single study, but rather a body of evidence. Confidence ratings begin by considering study design. Randomized trials are initially assigned high confidence and observational studies are given low confidence, but the number of factors may modify these initial ratings. So confidence ratings may decrease when there is increased risk of bias. So risk of bias is not good, right? if there's inconsistency, imprecision, indirectness, or concern about publication bias. All of these will decrease confidence. Now, an increase in confidence rating is uncommon and it mainly occurs when the effect size is large.
That concludes this presentation.